Could access to healthy food change your diagnosis, your medical costs, even your outcome? One community is determined to find out. Ceres Community Project provides low-income people struggling with serious health conditions free and low-cost home-delivered meals in an effort to show that quality, healthy food can indeed improve health and lower healthcare costs.
They have the best food available, and they prepare it and bring it to my home for me and my family. I mean, what's better than that?
All meals provided by Ceres are prepared by local youth. Over the past 11 years, the organization has worked with over 2,000 teens to make over 630,000 organic meals for almost 4,000 low-income families.
I can't express enough how grateful I am. It means everything to me, honestly, and for my kids.
Ceres Community Project believes that food as medicine can change people's health, but now they want to prove it.
I've noticed that since I've started eating the healthy food that we've gotten from Ceres, I just feel so much better all the time.
Everything was so right for my body. I feel healthier.
They recently became part of a state-funded program where researchers will spend the next 3 years analyzing the effects of healthy, organic meals for low-income people struggling with congestive heart failure and type 2 diabetes. Really excited to welcome to the show the Executive Director of the Ceres Community Project. Catheryn Couch joins us now via Skype. Catheryn, I cannot even begin to say how proud as a physician we all are of you and your efforts in the community. So thank you.
Thank you.
And a lot of us can talk about letting food be your medicine, but I have to ask you, when you decided to take this task at hand, what was the big motivation?
The original idea really came from a friend of mine who asked me to teach her daughter how to cook in 2006. And I've had a long interest in food and nutrition. And what I did was I put a project together where Megan and I cooked once a week for 3 families who were dealing with a serious illness. And what I saw happen was 2 things that I really cared about. The first was young people actually learning how to cook healthy food. And we know that so many of them now are growing up in families where that doesn't happen. And the second thing was that when people get sick, food tends to go to the bottom of the priority list. There's a lot of stresses in their lives, and it's the time when they most need to eat well. And so at Ceres, we bring those 2 things together in service of our community being healthier in the long term.
So right on. The question is, what took us so long?
Right.
I mean, this is such an awesome project.
Yeah, and what I really love about it is, you know, sometimes people do everything they can and just financially they don't have the means to buy foods that are really good for them. And a lot of times they will eat a lot of processed foods either because it's cheaper or because of convenience, like you were saying. So for someone to just show up, sometimes just someone showing up and saying, hey, I'm here, I care, and I want to help you get better, that means the world to them. So how has the community responded to your program?
Well, I think what you're saying is absolutely true, which is so many of our clients are going through cancer treatment. They're really at low income. They don't feel like eating. And to know that people who don't even know them are making these meals for them, not only are they getting this prepared food that they don't have to think about, so it helps them eat even when they don't feel like it, but they also know that they're cared for. And there's a huge amount of research around social connections and health outcomes. So both the food and the love make a difference.